Measurement of blood pressure. It is defined as the force of circulating blood on the walls of the arteries. Blood pressure is an essential vital sign that comprehends the hemodynamic condition of the patient. The systolic and diastolic blood pressures are recorded, from which the mean arterial pressure can be calculated, with a formula shown in the presentation. Indications to measure blood pressure. To screen for hypertension. To monitor management status. To estimate cardiovascular risk. Contra-indications. Following are some relative and absolute contraindications of measuring blood pressure using a cuff on the affected arm. Absolute contraindications are dialysis shunt, recent surgical wounds, and mastectomy. Relative contraindications are lymphedema, paresis or paralysis, and arterial or venous lines, such as venous catheters. Equipment. Manual auscultation. This includes two methods, palpatory and auscultatory methods. Auscultatory method includes auscultation of Korokov sounds. Requires a stethoscope and a sphygmomanometer. A sphygmomanometer consists of an inflatable cuff that is connected to a pressure gauge. Automated devices. These devices measure oscillations in blood flow as the cuff is deflated. Device-specific algorithms are used to calculate blood pressure indirectly. It is suitable for use by laypersons. Invasive monitoring. This method uses an invasive probe inserted directly into the lumen of an artery and is most accurate. It displays blood pressure variations with each heartbeat. Its use is limited to critical care or operative settings. Preparation. Some important preparatory steps to be taken when measuring the blood pressure are: explain the procedure and take informed consent from the patient. Reassure the patient and alleviate any anxiety. Ensuring the correct size of the cuff is used, ideally for a normally built adult. It should measure 16 by 30 centimeters. The middle of the cuff on the arm should be at the level of the right atrium. Procedure. It is carried out in 3 parts. Attaching the blood pressure cuff. Check if the blood pressure cuff is fully deflated and of appropriate size. Locate the brachial artery. Wrap the blood pressure cuff around the patient's upper arm. Line up the cuff marker with the brachial artery. Measuring approximate systolic blood pressure. Close the valve on the blood pressure cuff. Palpate the patient's radial pulse. Inflate the pressure cuff until radial pulse is impalpable. This is an approximate estimate of the patient's systolic blood pressure. Deflate the pressure cuff. Accurate assessment of systolic and diastolic blood pressure. Close the valve on the blood pressure cuff. Position the diaphragm of the stethoscope over the brachial artery. Re-inflate the cuff 20 to 30 millimeters of mercury above the estimated systolic blood pressure. Then slowly deflate the cuff at around 2 to 3 millimeters of mercury per second. Listen carefully for the onset of a pulsatile noise. The first Korokov sound represents the systolic blood pressure. Deflate the cuff until the 5th Korokov sound is heard, and it disappears, which represents the diastolic blood pressure. In case of abnormal reading, repeat the procedure on the same arm. Blood pressure can be measured at other sites such as the radial, popliteal, dorsalis pedis artery. Erroneous readings. Modifiable errors, which cause falsely elevated readings, are improper technique, smoking, exposure to caffeine within 30 minutes, a distended bladder, sitting in a chair lacking back support and crossed legs, cuff placement over clothing, use of a smaller cuff, arm placed below the level of the right atrium. Modifiable errors, which cause falsely lowered readings, are use of a larger cuff, arm placed above the level of the right atrium. Unavoidable errors. White coat hypertension is caused by apprehension of being in the presence of a medical professional. Masked hypertension is due to lifestyle changes made before medical appointments. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.